What's going on, everyone? Welcome back to my show. This video I'm going to be talking about a condition that a lot of people suffer with, and it can be very debilitating. I'm talking about vertigo symptoms. Now, vertigo can come from a lot of different things, but to break it down to its biggest categories, you have the peripheral system and the central nervous system. Now, the central is the brain, everything like that. And those types of vertigos and dizziness come from head injuries, vertebral artery diseases, or stroke, something like that. And that's a little bit more complex. That's not what this video is going to be about. It's going to be about peripheral system vertigo, more specifically a very common one that a lot of people have, and that's benign positional vertigo. And what that is it's an issue with the inner ear, such as if you just got finished with having really bad allergies, or you had a cold, something like that, or fluid or an ear infection, you can all of a sudden get symptoms of dizziness, not being able to walk properly, nausea, things like that. Now, there are some things you can do at home that can actually help with those symptoms, and I'm going to show you that today. Now, whenever you all of a sudden start getting like a headache, or you start feeling like the room is spinning, something like that, what I want you to do is find a low light area, have a seat at first, and it's all about eye movement and control. So first, what I want you to do is find a point in the room, like up in the ceiling on the corner, opposite to where we're going to go. So make sure I got some room. What I'm going to do is I'm going to slowly lay down on my side as I keep my eyes pointed this way. Keep your eyes pointed up. And just hold that position for a little bit. And then once the room starts to, lighten up, stop spinning as much, I want you to come back up. And then we're going to look at the other corner of the room. And then slowly lay your head down again. And again, hold this position till the dizziness stops. And then you want to come back up and hold this here. Now, whenever it starts feeling a lot better and the symptoms really reduce, you can go to the next phase of that. And that's laying down. You can take a pillow, lay down on your couch or something like that, as long as you have your head tilted back. So you're going to lay down just like this. And then what you're going to do is you're going to tilt your head, kind of one ear versus the other. And then what you're going to do is look up the opposite way, and then keep your eyes fixed at one point on the wall the whole time. So I'm going to just keep staring at a point in the wall and just do this. And you can hold that position for like a minute or two. See how my head's flexed down, and then we're going to go the other way. And the whole time, even whenever you transition movements, you want to keep your eyes fixed at one point on the ceiling. Now, this type of maneuver you can do daily, and it can definitely reduce the symptoms of vertigo. Also, I'm going to show you some things we do in the office too that helps patients that reduce those symptoms of vertigo as well. So Margaret here is going to help me demonstrate the Epley maneuver. And what that is going to help a lot of our patients with vertigo. Now, it's a little bit of a different variation to that, which I feel like helps a lot too. It's a combination of Epley's maneuver and SOT, cerebral occipital technique. So first and foremost, I'll have Margaret, I want you to look up at the ceiling at one point. So what you're going to do is tilt your head just like that. Keep your eyes fixed at one point in the corner of the room. And then you're going to have them slowly lay down. Go ahead. Just like that. Good. Now, what I'm feeling for is the occipital fibers, seeing if anything's moving, and I'm checking for nystagmus, like the eye twitch. Going to about 90 degrees. Keep looking at that point. Follow my finger. So I'm feeling for like taut fibers or spasms in the muscles in the neck and the eye twitch. Now that I found it, I see is at C2 and C1, and you can also find like misalignments there. So what we're going to do is we're going to adjust it as well. Is it okay to adjust you? Okay. Close your eyes for me. Good. Good. Follow my finger again. And then we're going to do Epley's maneuver once more. Look up. And what this does is it should realign those crystals, those Slinthian crystals in the inner ear, or the labyrinth, which helps with balance and sense of direction. And that's it. Alright guys, that's just a few maneuvers right there that should help with peripheral sensed vertigo, benign positional proximal vertigo mostly. And so what that really is an inner ear problem where the calinthium particles, are basically called the crystals, are misaligned in the inner ear, and what happens is that maneuver actually helps realign them so you don't have that type of issue. And this happens with people that get like bad ear infections, have like are starting to lose their hearing, things like that. You can have issues with vertigo. Now in another video and a few other ones, we're going to talk about central nervous system vertigo, or a little part of that when it comes to concussions and post-concussion syndromes. And there's a lot more with that, and there's a lot of important things that people can do to help train that back and actually help motor skills become more cognitive as well, and also help stroke patients. So stay tuned for those videos, and I appreciate you guys watching, and don't forget to stay active and healthy.